Good afternoon. Welcome to the 2021 ASPPH Annual Meeting Session, Preparing the Public Health Workforce through Competency Alignment and Training Programs. I'm Britt Saxvig, the Director of Graduate Student Services at the University of Maryland School of Public Health, and I'll be serving as the moderator for today's session. This session will explore approaches to prepare students for successful public health careers, including strengthening strategic skills and designing innovative internships and traineeships that enable a confident entrance into the field of public health. So before we begin, I'm going to do some housekeeping things. So this session is being recorded and will be available in the virtual meeting room platform in 72 hours. The session is also closed captioned and is available by clicking the closed caption button in your Zoom toolbar. Attendees may submit questions in writing at any time during the session in the chat box. Please indicate for whom which presenter you are directing your question to when you type in your question. We'll be taking a few questions at the end of each presentation. However, there will be time at the end of the session for some follow-up questions as well. And before we begin, I'm going to introduce our presenters that we have today. So Mayala Arana is a program coordinator at Columbia University Mailman School of Public Health. Kathleen Amos is an assistant director for academic practices linkages at the Public Health Foundation. JP Tost is a chairman of Atlantis, and Jennifer Tyson is a faculty consultant at Appalachian State University. And now we're going to start our presentations. Our first presenters are Mayala Arana and Kathleen Amos.
Good afternoon, everyone, and thank you for joining our session today. My name is Mayala Arana, and I'm the Center Coordinator for the Region 2 Public Health Training Center. And today, Kathleen Amos and I will be talking about harmonizing the strategic skills with the core competencies to strengthen education and training for the current and future public health workforce. This work was funded by the Health Resources and Services Administration, and we have no conflicts of interest to disclose. As I mentioned, I'm the Center Coordinator for the Region 2 Public Health Training Center, and we're housed at Columbia University's Mailman School of Public Health here in New York City. The Region 2 PHTC is one of 10 centers funded by HRSA with the purpose of increasing the number of individuals in the public health workforce, enhancing the quality of the workforce, and improving the ability of the workforce to meet national, state, and local healthcare needs. We do this primarily through the 4 objectives you see on your slide: training needs assessments with state and local health departments, developing and providing training to meet those needs, and supporting the future public health workforce by funding student field placements and student faculty collaborative projects that address medically underserved communities. In Region 2, we focus on vulnerable communities in New York, New Jersey, Puerto Rico, and the US Virgin Islands. And we do this by working in collaboration with our wonderful partners at the Rutgers School of Public Health, Impactivo, located in San Juan, Puerto Rico, and the New York State Association of County Health Officials.
And hi, everyone. I am Kathleen Amos, and I am the Assistant Director for Academic Practice Linkages at the Public Health Foundation. And just to introduce our organization as well, the Public Health Foundation, or PHF, is a national nonprofit organization. We're based in Washington, D.C., and we exist to serve the public health and population health workforce. We do this primarily by providing resources and tools, training, and technical assistance. And our work is focused in the areas of organizational development and performance improvement, and in particular on quality improvement, performance management, and workforce development. And as part of our focus on workforce development, we serve as the convener and provide staff support for the Council on Linkages between academia and public health practice, of which ASPPH is a member, and which produces the core competencies for public health professionals. Thank you.
So in the next 10 or so minutes, we'll provide a little bit of background about the core competencies for public health professionals, as well as the strategic skills for the public health workforce. Then we'll talk a little bit about why we saw a need to harmonize these sets. Then Kathleen will walk us through the methodology that was used to develop this crosswalk. And then we'll talk about implications for education and workforce development. So as I previously mentioned, there are 10 regional public health training centers located across the country in each health and human service defined region. These centers are housed within CEIF accredited schools of public health with the intention to be a bridge between academic public health and public health practice. We all have the same 4 legislative objectives as I mentioned on the second slide. As a network, the PHTCs deliver mostly free, high quality training that is regionally relevant. We also connect students with experiential learning opportunities, mostly in health departments and other organizations that serve medically underserved communities. And we assess training needs for our state and local health departments. The PHTC program has been around for a little over 20 years. And in the most recent iteration, HRSA tasked the PHTCs with addressing 3 of the 8 strategic skills developed by the de Beaumont Foundation. And so those skills include systems thinking, persuasive communication, and change management. So what are the strategic skills? In July of 2017, the de Beaumont Foundation and its National Consortium for Public Health Workforce Development released a call to action that laid out 8 cross-cutting strategic skills that were to be the priority skill areas for the governmental public health workforce. Prior to that, we were all kind of developing training around the core competencies for public health professionals, which are a consensus set of foundational or cross-cutting knowledge and skills for all public health professionals. So these were developed by the Council on Linkages between Academia and Public Health Practice, and they are regularly revised with the current version having been released in June of 2014. These competencies function as a starting point for organizations working to assess and meet training and other workforce development needs. Additionally, the Public Health Foundation also released the competencies for population health professionals in March of 2019. The population health competencies are a set of skills desirable for population health professionals, which includes professionals in hospitals, health systems, public health, healthcare, and other settings who engage in the assessment of population health needs, as well as the development, delivery, and improvement of population health programs, services, and practice. These competencies are based on and aligned with the core competencies for public health professionals. So this crosswalk that Kathleen will walk us through in a moment was developed with the Public Health Foundation, and it seeks to harmonize these 3 different skills and competencies that the public health workforce utilizes to varying degrees. We saw a little bit of a tension between the public health training centers being mandated to develop training based on the strategic skills, but working with our health department partners that require competency-based training that aligns with the core competencies. So this crosswalk that the Region 2 PHTC and the Public Health Foundation developed provides a structure for workforce development and for student training opportunities that put the strategic skills, the core competencies, and the population health competencies in communication with one another to ensure that the public health professionals in the field and those entering the field are able to fill essential roles in government.
Fantastic, thank you. So as Mayala mentioned, we went through quite a number of steps in developing this crosswalk, and we kind of laid them out on the screen here. But essentially, we began with the strategic skills, and we pulled the list of strategic skills and their definitions out of the de Beaumont Foundation's Building Skills for a More Strategic Public Health Workforce report, which you just saw on the slide. So we combined the definitions with the skills themselves, and then we broke each skill down into its component elements or pieces so that we could map competencies to the individual concepts that were contained within each of the strategic skills. Before going ahead and doing this mapping, as well as at several other points during the process of developing the crosswalk, we shared what we at PHF were working on with Mayala and her colleagues at the Region 2 Public Health Training Center, as well as with the de Beaumont Foundation to get their input and feedback. So once we had that feedback, we moved ahead with mapping the core competencies to the kind of the component pieces of the strategic skills, if you will, with the intention of trying to indicate which core competencies might be needed to do a particular strategic skill. To do this, we used tier 2 of the core competencies, although we did pull competencies from tier 3 when there was no equivalent competency at the tier 2 level. So we created an initial mapping. We kind of reviewed and revised that a number of times. And as part of this process as well, we compared the work that we had done to a mapping that was developed by the Public Health Training Centers a couple of years ago that mapped the first three strategic skills and the core competencies. So we kind of went through all of this process, this reviewing and revising process over and over again, one component at a time, really trying to think it through and challenge our assumptions and any decisions we'd made about including or excluding specific competencies. And once we felt like we had a pretty good first draft of this core competencies mapping, we then mapped the population health competencies to the core competencies and the strategic skills. So again, with the same intention of trying to indicate which of the population health competencies were relevant for doing particular strategic skills. So we went through really the same process of kind of reviewing and revising and arguing with each other over whether to include or exclude something. And once we had a pretty good first draft of that mapping, we again went back to the core competencies mapping and adjusted it and kind of like rethought things based on how we had mapped the population health competencies. And then we went through the whole thing again and tried to make sure that we hadn't missed things or that sort of stuff. And also to identify any competencies that we really hadn't mapped to any of the strategic skills. Once all that was done, we organized everything, addressed any outstanding questions or concerns. And then we sort of put all the pieces back together. So we recombined the elements of the strategic skills and then went through and eliminated duplication. So there were a lot of places where we had mapped the same competency to different parts of a strategic skill. So I'm just sort of pulling all that back together and finalizing it to create the final version of the crosswalk. Next slide. And that final version of the crosswalk was completed in June of last year. And it illustrates what competencies may be needed to perform the strategic skills. The crosswalk, along with a longer version of the crosswalk in which the strategic skills are still separated out into their component elements, as well as information about the methodology that we used in developing the crosswalk is all available online. And I can throw that link in the chat box too if anyone wants to check it out. Next slide. We also too wanted to acknowledge a few limitations related to this work. So one, obviously the crosswalk reflects the versions of the strategic skills, core competencies, and population health competencies that were available at the time that we created it. And this is especially relevant because both the strategic skills and the core competencies are currently being revised. So the crosswalk would need to be updated to reflect, the changes that are made to those skill sets. Two, in developing the crosswalk, where kind of definitions or intentions weren't totally clear, we did make some interpretations as we were going through the process. We tried to note that and be clear about the assumptions that we were making, but different interpretations obviously could have led to different mapping. And finally, these three competency or skill sets all contain related but not identical concepts. And so there are often differences in sort of the specific focus or scope between the various statements that they include. So because of the way that we constructed the crosswalk is meant to reflect the competencies needed to do a strategic skill and not the other way around. So depending on the specific strategic skill, there may be elements of a competency that's mapped to it that are not directly relevant, or you may need additional competencies. And also, of course, being able to perform a strategic skill does not necessarily mean that an individual has attained all of the competencies that were mapped to that skill. Excuse me.
Sorry, I was trying to unmute myself. Thank you, Kathleen. So our hope is that this crosswalk is utilized by not only the public health training centers, but also schools and programs of public health, as well as other health departments in assessing training and education needs, as well as in developing training for the current and future workforce. Additionally, we were just kind of seeking to reduce some confusion as we continue to work with health departments and in supporting students, both in the classrooms and in, field placements and things like that. So yeah, thank you all so much. Here is some of this information. Kathleen will put this in the chat box, right? So thank you all so much, and feel free to reach out. And I think we have time for maybe one question, two questions.
Okay, well, thank you, Mayala and Kathleen, and we can go on to the next presenter, JP Tost.
All right, good morning, everybody. I hope everybody's doing well. I'm going to connect here on these slides. Just give me 1 second. Apologies, just 10 more seconds here. And I apologize. The reason I'm struggling here is that Zoom's changed here, the buttons, I think because of the format where I'm looking for, oh yeah, share screen, 1 second. All right, please confirm when you can see the slide that is in front of you. Let me just maximize it. Can you all see,
We can see.
These on full screen? Okay, great. Can you all see this on full screen? Okay, great. Thank you all very much. So my name is JP Tosh, and I'm with Atlantis. It's my pleasure to be here today for the first time really at the ASPPH and to talk to you all about designing innovative internships for children's health and racial equity, which are two topics that are integrated together with this in this presentation. And I'm also very much honored to also be here today with Chaya Merrill from Children's National Hospital in Washington, D.C., who is far more of an expert on public health than I am. She will bring in the topics on this presentation that are focused on the actual project that we ran with Children's National Hospital. And so just a really brief intro. I founded and have run for almost 15 years since I founded Atlantis at the University of North Carolina at Chapel Hill. And Atlantis is the global leader in healthcare experiential education. So that means we run the most non-classroom programs for undergrads in healthcare. And our historical focus has been not public health, but particularly it's been pre-med education, experiential education, and most of that has been abroad. So if you are a pre-med student that studies abroad, you will most often go with us in our programs. And some of our programs that we have also run do touch on public health, and that's why we're here today. And I want to now, and now I'm going to go ahead and have Chaya go ahead and describe and introduce Children's National.
Yes, hi everyone. Chaya Merrill from Children's National Hospital. And as JP said, Children's National Hospital has been around for quite some time. The hospital itself is about 150 years old, but I work very specifically within a department in the hospital called the Child Health Advocacy Institute. And I just want to talk a couple minutes about this Advocacy Institute because I think it is far more aligned with the concepts of public health than maybe folks would associate a hospital to be aligned with. So obviously as a hospital, we do focus on clinical care, patient care, but this Child Health Advocacy Institute, we call it the CHI, and the joke is Chaya works for the CHI, which is my name. But the Child Health Advocacy Institute takes a non-clinical look at care. So our mission at the Advocacy Institute is to make sure that every child has an opportunity to grow up healthy and happy, to help kids grow up stronger, even outside of the clinical environment. So we push for policy and systems changes that impact a child's ability to live a healthy life. And a lot of these policy and systems changes focus on things like racial equity, access to good food, safe housing. So many of these factors that are outside of the hospital environment. So really happy to be here today and talk a little bit more, a few slides down, on the project we worked with Atlantis on.
Thank you very much, Chai. And it's been an incredible honor for us to work with you all at Chai and with Children's in general. And we're Northern Virginia and BC based. And so Children's is not only one of the, the premier children's hospital in DC area, but it's also one of the best pediatric hospitals in general in the United States. So I'm going to go ahead and this presentation is going to be structured as the two topics that we have that are intimately connected. One is broadly what has been the success we have had with a particular approach to public health internships that we're really, really excited about. Why does it work so well? That's half of it. And I will focus myself more on it. And the other half is the specific case of our project with Chai at Children's National, which was specifically on racial equity in healthcare. And Chai will talk more about this in a few slides. And so just to start with the broad concept of internships, here's the problem. And this is not a problem only in public health, but it most certainly is a problem in healthcare in general, and certainly in public health, which is this. Meaningful internships are hard to find because students have so little experience in general that they bring low value for hosts. In other words, it's a bit of a chicken and egg problem with internships, naturally, in any field where we want a host institution to accept our students, but then the students don't create enough value for the institution to be worth the quote unquote hassle. In other words, there are certain costs and risks and problems that come with hosting students for internships. And those better be essentially made up by the value that the students bring. And this is a fundamental economic tension and one of the biggest barriers for early career experience. So if you are a student in healthcare, you would love to go and contribute to an established organization such as Children's, but you going there brings all these costs and problems that it is not worth it for the institution unless you are particularly good, unless there's other factors at play. And that's the problem. And so the approach that we've come up with is an approach that follows a solution to this problem in the real world, which is there's this whole industry, which is management consulting. Management consulting, an industry that is very much loved by undergraduates in many different fields who want to have a very intense job after graduation. Not only business majors, but people in general who want to learn a lot after undergrad. It's also an industry that often has a bad name because we have a bunch of external people that come to our organization to give advice. But essentially, consulting has figured out for the last several decades very well, how do I bring recent undergrads from universities, usually business majors, but not always, and how do I put these people that don't have experience in business at all, and how do I make them create meaningful value for organizations that are actually paying their salaries when they just graduated from college, right? And consulting has found the answer to that. And the answer is there's a structure that they follow, whereby if you go to UNC Chapel Hill and you major in anything, it could be public health, it could be economics, it could be business, and you work for a consulting firm, you may be placed on a project for a client where you are then essentially leveraging what? Not your subject matter expertise as much, but more of your analytical ability and your ability to process data and be part of a team. So with that long introduction, let's see what that looks like in practice. So an ideal internship in public health and in other fields, ideally you'd have someone learn foundational skills, actually tackle policy questions, and develop outside the box solutions. And to go back to the previous presentation and to Kathleen's words on it, you mentioned the domains of public health and the core competencies. And essentially, if you look at those 8 core competencies, number 6, public health sciences skills, of course, is very much emphasized in curricular programs, very much emphasized. And if you look at the approach we're using for internships, in many ways, it strengthens all of the 8 except that one. So in other words, it doesn't leverage your public health skills at all. It leverages your other things around it, giving you a very meaningful experience. And to mention a specific example, and again, I'm still talking about the structure of this, and Chai will talk about what it actually meant in practice in this topic of racial equity in healthcare. But essentially, if you think of a team of students that are interning at an organization, you would ask yourself, what qualifications do they have? What project can they be done, and who will manage them, right? And essentially, if they are undergrads or grads, but in general, early career, they don't have a lot in terms of subject matter expertise. So if that's the case, then an ideal project would somehow not leverage that, but leverage their general analytical ability and generally their willingness to work on anything that can help an organization. So this is actually an example of an agenda for a very short project. In fact, the last one that we ran with Children's, that shows that even in a short amount of time, students could do a lot of things to make their experience meaningful. Moving on to the next slide, and before we talk more about Children's, this is just, we are doing this not only with Children's, but we are doing this with other organizations in healthcare and outside of healthcare. Of course, the focus here is public health and healthcare. But essentially, we follow that same model that has worked in several areas. So in conclusion, the consulting model, again, if you structure an internship in undergrad or grad, but if you structure an internship just like a consulting firm might structure its work, it likely will allow you to make your students work as a team in a way that's meaningful for a host that would otherwise not accept your interns. That's generally what we found in several areas, not just with Children's and not just in public health. And with that, I'm going to go ahead and introduce really briefly then more on this specific project we've done with Children's. And before Chaya describes it more, just to give you the overall specs, what we've done is last summer and this past winter, we've run short programs, 2 or 3 weeks long, with several students. In this specific case, not generally healthcare students, actually, although that doesn't matter in this case. Essentially, students who are all undergrad, or almost all undergrad, who are working as teams, and they were working on community health, and specifically this community health needs assessment tool. So, and again, our organization was in charge of finding these students, structuring this program, and then actually running the project. And then as if we were a consulting firm with a client, quote unquote, being Children's. Of course, Children's is not paying us, nor are we paying Children's. But the idea is that it's a win-win because Children's benefits from this work and our students benefit from the experience. So with that, I'm going to leave it off to Chai to describe more about this awesome project.
Yes, absolutely. If you could just advance to the next slide. And I'm going to be really quick because I know that we're running low on time, but I just want to give you a flavor for the type of work the students did with Children's National Hospital. So we were presented at Children's with this problem that happens in many urban areas, many rural areas across the country, where we knew that children in our community didn't have the same opportunity to thrive as other children living in the community. But we wanted to quantify that. We wanted to know, where in our city were children living with the lowest opportunity? Where are the children with the highest opportunity living? What does that look like? What's contributing to this low opportunity? And then really importantly, what can we do about it? So we divided the groups into 2 groups, essentially the Atlanta students, one working more from a quantitative perspective to actually come up with some numbers to quantify the level of opportunity available to different kids living across our city and where they live. And then the other group more related to community engagement efforts. So as you all know, in public health, a lot of varied skill sets. I myself have a public health background, but I also spent quite a bit of time in consulting. So I know firsthand experience that I'm more quantitatively trained, but there are a lot of public health colleagues that are experts in the community engagement field. So we were able to divide the groups according to their background, as well as their interest levels and experience into these two groups. And they worked for 2 to 3 weeks on producing really compelling information that helped answer the questions that I laid out. I want to point out that the benefit was not just in one direction. While Children's National did get some really valuable input and information from these students, from the feedback that I heard and living that experience with them, I believe that they really received some good mentorship as well. So, I met with them, we talked about their products, we talked about the process. They learned really good communication skills from a presentation perspective, from writing their documents. I wasn't easy on them. I was pushing them to get exactly what we need. I was a former consultant, so I know that world really well. And I would say that one of the big things that they learned that we haven't talked about, important skill, is how to deal with uncertainty. When you're working with clients, a lot of times they don't really know exactly what they want. They have a broad idea. So this team was really able to work with the Atlantis mentors. The consulting folks have tons of experience, worked with the students who then worked with me to further define the problem and then really be okay with the uncertainty and still deliver something that was really compelling and helpful. It was a really fabulous experience for Children's National. I'll turn it back over to you, JP.
Thank you. Thank you so much, Chaya. Really appreciate your kind words and everything we've done with you all. Just because we're essentially out of time, I'm going to just close by saying that that the conclusion is that we think we found a way that works for both the host and the students in a way that is truly innovative, and that we hope we do in more places and also at Children's. And we're going to stop there. And thank you all very much for listening, and let us know now or later if you have any questions. Thank you.
Hey, thank you, JP and Chaya. We'll have questions at the end of the session if anyone has questions for them. And now I'd like to introduce our last speaker, Jennifer Tyson.
Hi, everyone. Can you hear me okay? Excellent. I have Emily Benson here with me. She's an Appalachian State University student. And I also have Molly Fox, who has been unfortunately kicked out of Zoom a little bit. So we'll see how it goes. Thanks for being patient, Molly. Glad to be here. Thanks for introducing me, Britt. So exciting to follow up these two presentations because the first one is really highlighting a separation between practice-based competencies and public health competencies as a whole. And I think that's what our program is attempting to help bridge and cross over. So the public health pandemic started taking place last year, as everyone knows. I joined the faculty in the fall and had been working for a long time as a consultant and a local health department person, and specifically working in public health preparedness. So when I joined the faculty, a lot of students were online, they were tired, they were in public health, so very driven to know what was going on, but didn't have a ton of experience in public health preparedness itself. I was also, on the other hand, at the local health department level, getting asked questions like, oh, Jennifer, don't you work with a bunch of talented public health students that could potentially help us because we're drowning? Aren't there people out there that could help? We could hire to do call center, contact tracing, case investigation, vaccination planning, so many needs at the local public health level this past year and continuously, and hopefully with some of the new funding, that infrastructure will continue. So I heard students say that. I'm a total nerd when it comes to public health preparedness, and I thought, well, what could we do? What would be helpful? So we created, I don't know if anyone's ever heard of this style before, it's called a mastermind. And basically it's when you have a group of people interested in the same topic and you formulate a long-term relationship building network. So you come together at a certain number of points, you do a little bit of training. The students completed 2 different training sessions that will literally make them qualified for any public health preparedness job at a local and even at a state level. So this is, yes, a mastermind, Laura. It's called a mastermind. A few people in consulting and a lot of social entrepreneurs talk about this word mastermind. And the idea is, and I'm happy to share the outline that we use to build off of it. I'll go ahead and share the screen for the website that was built in order to support students who wanted to apply to this. It started out as a traineeship, the name changed to fellowship. That's what we're going to keep it at, because these students really ended up being very strong fellows and leaders in discussions around public health preparedness, what it means, and you'll hear from them in just a second. So I will drop this link in the chat in just a moment for those that are interested and curious. This is the first cohort that we've had. We start out by getting to know each other. We set intentional goals and we talk about how we're going to implement those goals. And this particular group was really interested in just, 1, getting some background training, and 2, hearing about what was happening at the local level with all of the different responses, which we were able to provide. And then a unique component of the mastermind that this group really wanted is to hear from other people in the field. So we've been inviting professionals. We just heard from a university emergency manager who is living through his first pandemic or public health response ever. We're going to be hearing from a dental director in the coming weeks who has been responding in their own way in a public health manner. And it gives them a platform to ask questions, to be candid, a bit informal, because these topics can be tough to talk about sometimes. A lot of the workforce has gone through a lot lately. So it's a really shared platform around getting to know each other and asking questions. So this website, it's a place to put the advertisement. It's a quick Qualtrics survey asking what their interest is, letting them know what the timeline is like, and then go ahead and send us your resume. So we do a little bit of professional development. And then I was really excited about the humans that were joining us. So I created a couple pages where their names were posted and students could contact each other. And then we're generally updating this. So what are we doing? We're submitting abstracts to present. We are writing papers. We are getting to know professionals in the field, all driven around public health preparedness. And then there's this feature here, which gives, this platform is Google Sites, really easy to use if you are into building websites or a platform that people could easily access. So the cool thing about this is you can only allow certain people to have access to it. So it allows for a fellow platform in the background. And this is where they can find various things, how to contact me, what's my cell number, what's our goal, what is our current timeline, what do we aim to do? Oh, we didn't get everybody to join for the first intro and orientation, so we recorded it and we posted it. Here's information on the 2 different trainings that they currently complete. Here's the outline to the mastermind itself and how that is built. And then, the team itself and contact information so that they can connect with each other. So I'm going to stop sharing my screen and pass it over to Molly Fox. Molly, give us your perspective.
Yes, awesome. So first of all, thank you so much for having us and for time today. I just want to say this fellowship has been such an amazing experience and I have learned so much over the past few months. For me personally, I would say what's been the most helpful throughout the fellowship has been the real world application and the mentorship that we've received. It's been so meaningful because I can see how all of this really plays out just in the day-to-day of emergency response, because there's always so much going on, as I've learned. I also think it's cool that we've been able to learn concepts and receive training that's going to allow us to do projects in the field. Like Jennifer mentioned, through that contact tracing case investigation, we can get jobs, which is so cool, and something that's really unique. But yeah, it's just been awesome. I'll let Emily go ahead and talk because I know we're running short on time, but I just want to say I'm so thankful for this experience. And I really hope to advocate for this work in the future by knowing a little bit about this.
Yeah, so I just wanted to say, like, this training or the fellowship that Jennifer has created, it's just been such an invaluable experience to be a part of, and like has been super enriching into my education as an undergrad. And it's just really given me a new perspective of public health, and has, like, specifically through the guest speakers that we have that she's been talking about, they have come and shared their personal experiences with us. And it's just been so valuable for me to hear, because I often personally learn through hearing about other people's experiences in public health and the challenges that they've gone through. So getting to hear with and talk with the individuals who have had experience in the public health field, and just have that private conversation with them on a smaller platform, I guess, has just been so enriching and helped me just to feel more prepared to go into the field of public health in the future. So honestly, it's just been such an amazing experience, and I would have not traded it for anything. So yes.
I totally prompted them to say all of this. Just kidding. But I do think that that gives us a good overview, and I would love to answer any questions that people have. So I'd like to defer the time back to you, Britt, and see if there's any questions people have.
Okay, thank you, Jennifer. So now we'll take some time to ask questions. And if anyone has questions, you can write them in the chat. And please remember to enter the name of the presenter that you're asking the question to. And I can just start with a general question, Jennifer. How would you recommend replicating a fellowship like this?
Oh, excellent. I think, and Emily and Molly speak up, the whole basis of this has been very doable because it was students asking for something, and then us responding as their colleagues, co-workers, getting them ready for the public health force. So I think it would be great to have those sort of platforms where we're listening to students, especially during a pandemic. It's literally consuming all of our lives. And as public health professionals, there's a lot of momentum in our field that's been brought. So I guess listening to the students first and see how they respond. I see Molly shaking her head. Did you agree?
Yeah, I think that's been the most meaningful aspect for me personally. And something that I've learned about myself through this is that I learn through application. So having the flexibility to ask questions and to have presenters come in and share their expertise with us has really been invaluable, because you've been able to work with us as new things come into our minds and as we're learning new concepts and new ideas. So just that flexibility and the huge learning aspect of it.
Thanks, Molly. Emily, any additional thoughts?
No, honestly, I think you hit it right on the dot there. Like, it's just been so, like, Jennifer has been so, like, flexible about listening to what we wanted to do, listening to what we wanted to hear from, taking our thoughts as to, we wanted to hear about, like, how her public health department was responding to the COVID pandemic. And it was just so cool to hear from her first person perspective of what was happening, and things that we don't get to hear really in class. So.
And do you have funding for this fellowship?
What a good question, Britt. I have tried 2 funding opportunities and have not been successful just yet. I need to work on my grant writing skills. Currently, I don't, but the program that we are a part of is pretty new and growing very fast. So there's a lot of support to make time and to do that, but I am seeking said funding opportunity, and mostly for the students, right? Like, how cool would it be not only to get that work experience, but also to be compensated for doing it, right? And then one additional option that they have had is, okay, now they're trained, and when people ask me, do you have trained students that can help us, we can make a direct reference to different jobs, part-time, full-time, and whatnot at the local level.
And there's another question in the chat. Did you see that? Or...
I do. What do you foresee as any long-term challenges to continuing student involvement post-COVID and sustainability? That is such a great question. I think it will be important to get funding at some point. I think that I could offer it to more students. Right now, I do have to do an application process, because if it gets too big, then you lose a lot of that mastermind platform of being responsive. I think a positive around sustainability will be to continue the connection in practice. You know, someone called me recently a pracademic, and I love that. I think for sustainable reasons, we're going to need to continue to be working at the local public health, state public health levels in order, and inviting people who are experiencing that firsthand to come and share their experience and network with these students that are interested. Yeah, there is a course already going to be developed in conjunction, and the title is very snazzy. And it's public health preparedness for the zombie apocalypse. So I think that'll be important too, not only because some students don't have time to do something extra on the side, especially if they have a hard course load, or maybe they're working full time. I think it'll be really important to incorporate more diversity amongst students that are participating, and also leaders who are coming to the platform, so that, you know, students can see themselves in others and be inspired and able to, you know, kind of tap into those interests. So I think those are the ones that are come to the top of my mind.
Okay. Great. And I have a question. I think it's for JP and your team. How effective is it to have students of differing skill sets and educational levels working on the same project?
Thank you for your question. I'll let Chaya see if she has any views on that from her perspective. In other words, from the host perspective. But from our perspective, the answer is we follow the same approach that the management consulting industry follows sort of in the real economy, which is essentially people at different levels can be part of a team that is very meaningful. So just like in the real world, a student from the University of North Carolina at Chapel Hill graduating as an undergrad with a major in history may join a consulting firm, say Deloitte, at the same time that a student graduating out of the MBA program or even a doctorate in public health, say, and they will both join and be in the same team. Now, if they have less experience as consultants, they're probably going to be basically the lower level members of that team that does do the analysis, and the more experienced person is actually the manager. That's a more experienced consultant. That might actually be younger than the folks underneath. But in general, essentially, one of the beauties of consulting is precisely that it allows people at different levels to all contribute in a team, and then they're managed differently based on their experience, right? Which is, in general, the way we've approached our programs is to allow folks from different age levels. And I think that in our range of ages in the group at Children's was over 5 years, probably, from the oldest to the youngest, I'm guessing, roughly. So yeah, and I think it works. I don't know if Chai has anything to add to that, but that's the general answer.
Sorry, now I'm unmuted. So I'll just add a couple sentences to that. I think the question was about the amount, the difference in experience, but also maybe interest level as well. I would say that that's the goal. I think getting people from different backgrounds to work together to address a problem is how the real world works. I mean, you can't take problems out of context to solve them. So I think, you know, in our experience, we had these students come to us from quite a range of backgrounds, from, you know, pretty quantitative computer science, mathematics, to economics, to more social sciences. And I think to tackle the problem appropriately, it was really great to have a diverse set of experiences and backgrounds. So I think that would be the gold standard.
Thank you, Chai, and thanks for the question.
Okay, any other questions? So one other question is for Jennifer. What did you learn along the way of doing your project? And how did you have to adjust as it went along with the fellowship, developing the fellowship?
Well, the title changed pretty rapidly. Listening to students again, it is adjusting pretty quickly, wouldn't you say, Molly and Emily? This is definitely our first go. From the start to the beginning, what do you think of as we shifted? We've had presenters not show up, right? and luckily we had submitted some presentations and we're able to shift our time towards that. Grants, I've hoped to have had some sort of grant associated to it. The website and having a platform where students could go has been really helpful. There were 2 internships that were connected to this fellowship through the local health department so that both interns could have not only share their experience working on the ground as public health students, but also have a group of people that were kind of talking about the same thing and really collaborate and connect and ask the hard questions. And that has been very adapted, right? So as things have presented themselves, we have either taken them on or shifted a little bit based on, you know, what we have time for. And then I think the other thing is, you know, the Mastermind platform is really creating a network around implementing actions, right? And for this group, it was a Google chat. So we've got this ongoing chat with each other. You know, maybe someone found a really cool article, or someone got their vaccine, or someone volunteered at a clinic and this was their experience, or Jennifer needs a quote from students to, you know, to share the opportunity for the next round of students. So I guess what I'm trying to say is adapting to that communication level while also being in COVID, right? What do you think, Emily? Molly, any thoughts come to mind?
Yeah, I totally agree. I think that in the beginning of our traineeship, we were just trying to figure out what was going on. It was being developed and we were just trying to get to know each other. But I feel like now at the end, like, well, I'm sorry, training, it's a fellowship now, but it just changed, sorry. Towards the end now, we're all like really like, we really know each other well, and we're really able to dive into those deeper conversations about public health, things that are happening, especially right now in the world. And it's been very cool just to be able to have those kinds of connections.
Okay, great. We have another question. This is for all presenters. And was there a pre and post assessment of students' growth with regards to skills and competencies?
For us, it's mostly quantitative right now. It's whether or not they were able to complete those trainings, and then participation, and then a few quotes or qualitative feedback. But we are in the future definitely going to do a more formal competency measure. That's a great question.
And just to add to that, for us, we have done that, but we have done it more broadly from the perspective, not of the 8 public health competencies, but from the perspective of the consulting competencies, although they are actually hugely overlapping, more than half are overlapping. And the answer is that over 90% of our students basically agreed themselves that they had progressed in the competencies. That said, this is not just for our children's project. This is in general for all our projects that we follow this approach. Although we believe that this will be the case with every time we run this approach in a public health setting, we would probably have something like that number for progressing on competencies. Again, this is based on asking our own students for this answer. And this is a sample size of about 300 people or so. So it's not a huge sample size, but it's significant.
And somebody had written, can you share the mastermind outline too, Jennifer? I guess they weren't able to access it on the link.
Yes, it's secret because it's specific to the cohort. So what I will promise is to get like a drafted version and share it to the website as an example. I promise to do that within the next couple of days. So that if you have the link to the website, you'll have the link to, I'll call it like a template to a mastermind or something and put it on there.
Okay, any other questions? So we have another question for JP. Do you have a link to a good resource for to look at consulting competencies?
Yes, and I'll share that in the screen in here on the chat in the next couple of minutes. And I'll also save this person's name just in case I don't do it before the end of the call. And thank you for the question.
Okay. Well, thank you, everyone. I think this was a great session and really good questions today, and loved hearing about those experiences of the applied fellowships and internship training programs. So again, I'd like to thank all of our presenters for sharing your expertise and for your attention and thoughtful questions. A recording of this session, it will be available to registered participants following this meeting in about 72 hours on the virtual meeting platform. Closed captioning will be available as well. This session has been approved for CPH continuing education credit, and all registrants will receive an evaluation survey at the end of the annual meeting. And we really appreciate and thank you in advance for your feedback on the sessions.